rolling out a coronavirus vaccine. The UK is the first Western country to administer shots against COVID-19. As the rest of the world is watching, could this be the start of the pandemic coming under control? And will skeptics be persuaded to take the vaccine? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. It's hoped they're the beginning of the end of the pandemic. But public anxiety over the safety of coronavirus vaccines could undermine that goal. All eyes are now on how the Western world's first coronavirus mass inoculation program will work out in the UK. The nation has started rolling out the first doses of Pfizer-Biontech's vaccine against COVID-19. 90-year-old Margaret Keenan was the first person to receive the jab. The elderly, care home workers, and healthcare staff have been prioritized to receive the 800,000 shots now available. Neve Barker reports from London.
It is happening. A turning point in the global fight against a virus that's killed more than 1 million people around the world. 90-year-old grandmother Margaret Keenan made history, becoming the first person to be vaccinated with the Pfizer-Biontech drug outside a trial. She encouraged others to follow her lead.
Go for it because it's free and it's the best thing that's ever happened at the moment, so please go for it.
In a somewhat dramatic turn, the second vaccine went to a man called William Shakespeare, a poetic start perhaps to a new chapter in the fight against coronavirus. More than half of the people who've died of the virus in the UK are over 80. They're getting the injection first, along with elderly in care homes and their carers. Unused doses are going to frontline medical staff. The British government's called this V for Vaccine Day, but the Prime Minister warned it's too early to call this V for victory.
In Scotland, Northern Ireland, in Wales, in England, people are having the vaccine for the first time, and it will gradually make a huge, huge difference. But I stress gradually because, we're not there yet. We haven't defeated this virus yet.
Batches of the Pfizer-Biontech drug, approved for use in the UK last week, have been arriving from Pfizer's factory in Belgium. The logistical challenge has been immense. The vaccine needs to be kept at around minus 70 degrees Celsius. In England, dozens of hospitals with facilities to store the super-chilled drug are the first places to administer it. Scotland, Wales and Northern Ireland have also begun similar programmes. The government's ordered 40 million doses so far. An initial 800,000 will be available in the first round of treatment this week, capable of inoculating 400,000 people with 2 injections 21 days apart. We've shuttered our economies and struggled through months of grief and anxiety. Lives have been cut short and elderly people separated from their loved ones. We've known for some time that the only surefire way out of this pandemic is a vaccine. And now, a shred of hope that in the not-too-distant future, things might start returning to normal. It's hoped several million people will be vaccinated before the end of the year, when boxes of the vaccine that come in packs of almost 1,000 doses will be split up and sent to doctors' surgeries and care homes around the country. The vaccine can be stored at normal fridge temperature, but only for a short period. It's a day of mixed emotions, joy and hesitation. Most vulnerable people won't get the vaccine until next year, and with infection rates going up here in London and elsewhere, restrictions may have to get tighter before they get easier. But it is only a matter of months since scientists set their minds on defeating this common enemy, a process that normally takes many years. And now, against all odds, a sense the long march out of the pandemic has begun. Neve Barker for Inside Story.
Other countries have announced plans to roll out vaccines. Russia began injecting doctors, teachers, and social workers with its Sputnik V vaccine over the weekend. China is inoculating more than 1 billion people with one of its experimental vaccines. The U.S. could grant emergency authorization to a Pfizer candidate by the end of the week and start delivering to states immediately. The EU is reviewing Pfizer vaccine's safety and could authorize it before the end of the month. South Korea has announced it's secured enough doses to cover 84% of its population, but it won't start rolling them out until other countries' programs have been monitored for a few months. All right, let's bring in our guests. In London, we have Anna Blakney, Research Fellow and Bioengineer at Imperial College London, where she works on COVID-19 vaccine development. Azeddine Ibrahimi is Professor of Medical Biotechnology at Mohammed Fifth University of Rabat. He joins us from Kenitra in Morocco. Sterghios Moschos is a molecular virologist at Northumbria University, and he joins us from Newcastle in the United Kingdom. Welcome to each of you. Anna, let me start with you. With this rollout in Britain, how big a step is now being taken to control the pandemic? And can we say that this is now the beginning of the end of COVID-19?
Yes, it is definitely the beginning of the end, hopefully. But one thing we all have to remember is that it's not over quite yet. So we still have to keep the same public health measures in place, social distancing and wearing a mask and washing our hands, as well as the rapid testing, to be able to continue to control the spread until the vaccine is fully rolled out.
Azeddine, from your perspective, how much, as far as what happens with the rollout of the vaccine in Britain, is going to impact the actions of other governments in other countries going forward?
Well, actually, I'm very excited that it's starting, finally it's starting in Britain. And I think we are waiting for this day for many months now. And I think it's a huge success, not for one country, but for humanity. I think to be able in 1 year almost be able actually to have a vaccine and start rolling people is great. But I think, as you said, Mohammed, I think it's very interesting that every country should what's happening in other countries just to gain from their experience and absolutely try to do it in their context. And I think for Africa and for Morocco, it's quite different from other countries. But I think we will be able to benefit from what's happening in England, in Britain in general, to manage to do it differently depending on the context where we are.
Sterghios, it looked like you wanted to jump in. I saw you nodding along to some of what Azeddine was saying, but I also want to ask you if we can just take a step back for a moment and consider what Azeddine was saying, which is how remarkable it is that, in less than a year, scientists were able to come together and produce a vaccine. I mean, this is something that's unprecedented in the development of vaccines in this modern world of ours, isn't it?
It is very much so, and the thank you has to start from those scientists in China that identified the virus, shared the genome of that virus online straight away as soon as possible, notified everybody they could notify, and then the thank you has to continue and extend on to the virologists that started looking into what this means, the vaccine scientists that within a couple of weeks of that started designing what the new vaccine is going to be, the pharmaceutical companies who got together and said, we're not going to do this for profit, we're going to do this for the world, when the situation clearly was getting out of hand. And of course, we must not forget those people who signed up for those trials for a brand new vaccine technology with regards to the Pfizer-Biontech and Moderna vaccines, but also those who signed up for the trials knowing that they might get a placebo and they may not be protected. So there's a lot of thank yous that we all need to be giving out there, not just to the healthcare professionals, but also the technologists and also the other scientists that have come together to resolve this global crisis.
Anna, Britain, of course, has been repeatedly criticized for having botched its response to COVID-19. Do you believe that the country is actually going to be able to effectively roll out this vaccine and to vaccinate tens of millions of people in a matter of months?
Yeah, so I think what's really important right now is just the overall communication strategy. So I think scientists all year have been really excited that we've been able to rapidly make a vaccine, but now I think it really, the responsibility falls on us and the government to actually really educate people about what is this vaccine, how was it developed, how was it tested, just so that we can really start to promote confidence in the vaccine, obviously because, there's no point in making a vaccine if nobody's going to take it. So I think we're actually kind of just beginning the second challenge of really doing kind of a mass campaign for education around the vaccine.
Well, Azeddine, let's expand on what Anna was saying. I mean, she's touching on a point which is coming up again and again when it comes to COVID-19 vaccines, and that's vaccine hesitancy. From your point of view, how much of an impediment will this be in trying to effectively inoculate a growing number of people in so many countries?
Well, I agree completely with Anna, what she said. I think the word and the key word here is trust. I think if we want to go to mass vaccination, we had to get and gain the trust of the population and educate them and make really an effort as a scientist to communicate clearly with these people, to engage the communities, to have them to vaccinate. And I think it's something that is really not that easy to do, because I'm talking now and thinking about Arabic country where they have to use a really scientific language to do that. And I think it's very tough to do it and to convince people. But I think it's a very nice challenge to have, simply because we are not looking at the short term for COVID, but I think the post-COVID, because mainly we'll have more and more crises like that, unfortunately. And I think we should be ready, and the scientists should be really communicating transparency and engaging the community to push them to be enrolling in this kind of effort.
Sterghios, when we talk about, the anti-vaxxer movement, when we talk about vaccine hesitancy, we should remind our audience that we're not just talking about opposition to COVID-19 vaccines. We're talking about opposition to all vaccines. And in recent years, in many countries, there has been a resurgence of diseases like measles that were long thought to have been eliminated. How concerned are you that this movement is going to keep growing? And, if we can pick up on the point that Azeddine was making, what can governments and leaders and scientists do to combat this?
Okay, so the history of anti-vaxxers, if you like, goes back to the days of Edward Jenner, who came up with the idea of vaccination. It's nothing new. What is new is the presence of people who refuse to take vaccines for known preventable diseases, when there are still people walking around who remember the artificial lungs, those massive machines that people had to literally sit into in order to protect themselves from dying, because there was no other way to keep them alive after getting one of these communicable diseases that are easy to prevent. These are things that have happened within the lifetimes of people that are alive today. Perhaps not the younger generations, obviously, but people that are alive today can remember what it was to live without vaccination. Whether vaccination or not works, I think that's very clear. And we will see this again now with COVID-19. Now, what about the message? Well, the message has never stopped being important since before COVID-19, because we were having the problems with measles resurgence. It was never eliminated, but it was certainly contained to an extent that we didn't have to worry about it. But now we're seeing outbreaks in schools, and we're seeing outbreaks in countries where measles vaccination should be at the right kind of level to prevent this thing from happening. And this is an entirely preventable disease. COVID-19 is very likely to enter that family of diseases that are going to be preventable in the future, but still around, because somewhere between animal reservoirs and the anti-vaxxers and I don't know what else I will allow this to circulate, perhaps the next few months, the slow adoption of the vaccine, we will see the disease becoming endemic. And as a result of that, eventually it's very likely that this will become part of the younger generation vaccine program that is implemented in most countries. But the challenge is the message, and the rule book on how to convey the message was written 5 years ago. We had a situation in West Africa where people had never seen Ebola before. They didn't know what vaccine education is all about. The healthcare systems involved literally straw huts with no windows, like Microsoft Windows or something like that. And they learned from their local community leaders what they needed to do, and they did it. They changed their burial habits, they changed their everyday behavior, they became vaccinated when necessary. So we need to open that rule book that we wrote and apply it to our society, because we've seen it in the last 12 months. We've got nothing different to them when it comes to hesitancy, to disbelief, to conspiracy theories. The same things that happened in West Africa happened across the world. So now we need to move forward, educating these people and making sure that community and society is protected as much as possible.
Anna, if we're talking about obstacles, in the path of people getting vaccinated, on the one hand, you have vaccine hesitancy, which we were just speaking about, the anti-vaxxer movement, but then you have just the sheer logistics. I mean, this is very difficult, ensuring that, these vaccines are actually distributed. Could you talk us through the logistics of it, especially when it comes to, Pfizer's vaccine, the extreme cold storage that it will take? How difficult is this going to be?
Yeah, so the storage is definitely a difficult aspect of it, especially for the Pfizer and BioNTech vaccine, which needs to be stored at -80. But yeah, so I guess, logistically for the shipping, they're shipping it in dry ice packages, which keep it at that temperature. It's in a vial that contains multiple doses, and so those all need to be administered within a certain amount of time. But I think another, really important challenge is just organizing and finding the people that are going to be vaccinated first. So the UK is lucky in that it has a centralized healthcare system, and so everybody's identifiable in that way, and that's obviously will be key in distributing it. But yeah, it's a huge logistical challenge. So, the storage conditions of the vaccine make it challenging, but some of the other candidates like Moderna and the Oxford and AstraZeneca vaccines have slightly more amenable storage conditions, which will hopefully make it easier in the future. But it's going to take a lot of coordination between the government as well as local GPs in the first instance.
Azeddine, of course, it's not just about getting vaccinated and distributing this vaccine, is it? I mean, there is a large percentage of the population that needs to get vaccinated before you can start approaching herd immunity. How long does something like that take, and how much of the population needs to get inoculated before that immunity can take root?
Well, I think I will come back just to the question about the logistics. And I think for countries and continent like Africa, the role of the WHO is very essential, actually, for accreditation and giving recommendation for these countries, because absolutely we have different vaccines and the logistic is different from one vaccine to another. And I think there is a crucial role for WHO for actually the immunity and how long it's going to take and to get to the herd immunity. I think it's quite essential for any strategy, actually, for the first part of it, since we don't have enough doses of the vaccines. What's going to be very interesting is to protect this vulnerable population, actually the people over 65 years old and the people with chronic diseases. We have to protect them, and the priority will be given to them, actually. And the way to do it, so if we can manage actually to protect this 20% of the population, it will be interesting that we'll have less and less stress into the ICUs, into the hospitals, and hopefully we can get less people dying. So it's something very interesting. So I think for the first part, we'll be trying to protect this 20%. Maybe by June or something like that, we'll get more vaccines, second generation vaccines, and we'll be able to protect more people, hoping actually by the third semester to get actually to 60%, 67%, 70%. And this time we can talk about actually managing the COVID pandemic. So it's something that's going to take a little bit of time, and it's going to go by first step, protecting the vulnerable people, and after that, increasing the level of vaccination to get more people vaccinated and to the herd immunity.
Sterghios, if we're talking about herd immunity, we're assuming rather that there might be a vaccine that would prevent ultimately transmission of COVID-19, not just the disease itself. Do we know at this stage if the vaccines that have been developed actually prevent transmission?
Frankly, no. We need to see the data and see to what extent the individuals that have been vaccinated are actually shedding infectious virus. And this has not been disclosed to the best of my knowledge now. And I invite the other panelists to discuss any information that they may have. The importance here, however, is that we need to convey to the public a really clear and sober understanding that we cannot let our guard down. We can't go out and party, not for Christmas, not for Easter, April time, not for June, probably not even for later. We will have to put up with this social distancing and protection, as Anna put it, for many months to come, if we are to get to the point where there is this diverse protection. And there's another aspect here that it seems to have been forgotten over the last week. There's this thing called long COVID. There are people out there who experience the disease in a generally mild format, but they're affected chronically, and we still do not know what that means. We're still lacking evidence as to where else in the body the virus might be hiding and what it's doing in the long term. Why? Because we simply haven't had more than a year to see what's happening with people that get infected with coronavirus. So it's essential for the society and for the economy that we keep looking after ourselves, our families, our colleagues, by not getting exposed as much as possible over the next period of time until such time as the vaccines is received and it's ready to work, which is a month after the first dose.
Anna, do we have any idea yet how long immunity from any of the vaccines may last? And beyond that, what about those who've had COVID or those who find that they have antibodies in their system? Do we know if it's safe for them to get the vaccine?
Yeah, two really great questions. And actually, we've just gotten some big updates on this in the past week. So Moderna published a paper on the duration of immunity from their vaccine. And this is, we're still learning more and more about this every single day, really. So their paper showed that after the second vaccination, the patients or participants in the trial still had high antibody titers after 3 months. And if you look at the graph, it clearly is going to continue for a while. But at this point, all they can say is that it lasts for at least 3 months. This data is ongoing, so we'll just continue to add to this knowledge. And then there have actually been several arms of the clinical trials thus far looking at vaccinating people who have already had the natural infection. So they may already have antibodies to this. And what they are really wondering is, does the vaccine boost immunity to the natural infection? And overall, the overwhelming answer is yes. So even people that have already had COVID, it is still important to get vaccinated. And the idea here is that, the antibodies from a natural infection have been shown to last usually 3 to 6 months. There's a lot of variability depending on your disease severity. But by getting the vaccine, you would just boost that immunity even longer. So that's really the intention there.
Azeddine, in your previous answer, you mentioned more vulnerable segments of populations, especially the elderly, when it comes to the vaccine and when they would get vaccinated. I want to ask you about other vulnerable and marginalized communities in other parts of the world, communities like refugees, migrants, the displaced. Is there any indication of when those populations might actually have access to a COVID-19 vaccine?
Well, it's a great question, Mohammed. I think it's you are giving a human dimension to all this mass vaccination. It's going to be really a pity that we will cover all the rich country and somehow poor countries and forgot this kind of people that they are living in a really very bad situation. But I hope there is this program that is the COVAX program that is really managed by the World Health Organization. And I think, and hopefully, I have to check out that, but I think the refugees should be included at the population that is really vulnerable and it should be actually protected. But I think it's really something that we have to deal with it because as thinking about the COVID, it's really, as I said in the beginning, it's not just one country or one person or rich people or poor people, rich countries or poor countries. We're in the same boat. And I think we need to come out of this pandemic as a whole, as a nation somehow. And I think it's great that you have this question. I didn't think about it, but I think it's something great to think about the refugees. And I'm thinking about lots of refugees in Europe, in Africa, in Asia, and we think about Yemen, for example. There's lots of places we have to think about that.
All right, we have run out of time, so we're going to have to leave the conversation there. Thanks so much to all of our guests, Anna Blakney, Azeddine Ibrahimi, and Sterghios Moschos. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.